Students, in this lecture, we are going to discuss the calcium channel blockers which are used in China. But before going into the detail, you must know that there are two different types of the calcium channel blockers and what is the difference between these two types. So, my first question is that what is the difference between the dihydropyridine and non-dihydropyridine calcium channel blocker? So answer is very simple. Basically, these dihydropyridines that include the nifedipine and the amlodipine are potent vasodilators. These are the drugs, these are the calcium channel blockers which will act on the vessels, on the arteries. While the non-hydropyridines, which include the verapamil, are the drugs which will act on your heart. That will result in the myocardial depressant effect. So you can say these DHP, that are dihydropyridines, there are the potent vasodilators, while non-DHP, that are non-dihydropyridines, are the agents that will produce the more or the increased negative inotropic effect. One thing you must remember that this is not the ideal statement that if I'm saying that this particular drug will act on the arteries, it will not act on the heart. No, this is not the case. It will, if I'm saying that this is the potent vasodilator, it means it has more effect on the arteries, on the vessels, as compared to the heart. So this is the statement, this is the line which is also written in your book in the Lippincott. Now, first coming towards the dihydropyridine calcium channel blockers. Now, what are these blockers? These are amlodipine, felodipine, and the nifedipine. Now, these are mostly used orally. What these will do, these will minimize the cardiac contraction. They will definitely dilate your arteries. So this is the drugs that can be used in the variant angina. These are the drugs which can relieve from the coronary spasm. So these are the drugs which can be used in prinzmetal angina. You know that already in prinzmetal angina, there is spasm of the arteries. So this is the drug class which you can use in to relieve the spasm, which can be used in vasospastic angina, which is also known as prinzmetal variant, or the rest angina. Now coming towards the next drug of the same category, that is nifedipine, which is basically a short acting drug. Amlodipine and felodipine are the long acting ones, while the nifedipine is the short acting drug. This is a short acting drug, and this is usually administered as extended release oral formulation. But this drug should be avoided in the if this is short acting, then this should be avoided in the CAD, that is in the coronary artery disease, because in that case it will result in increase in the mortality after myocardial infarction, and it will also increase the acute MI in the hypertensive patient. Now, what is the reason why it should be avoided in that case? The reason is that when you use the short acting preparation of this class, it can lead you towards, or it may result in the reflex tachycardia. So it can worsen the ischemia. So in that case, these drugs should be avoided. There are different research articles on PubMed that are giving the same reason. They have written that you should avoid these short acting nifedipines, as because of the higher incidence of reflex tachycardia that has not been reported, that is less as compared to that of the long acting preparation. So what you can do in that case, in the post MI phases, you can use diltiazem and the verapamil. Now, what is diltiazem and verapamil? These are from the calcium channel blockers, which are the non-dihydropyridines. So this, then coming towards the next category, non-dihydropyridine calcium channel blockers. So what these drugs will do, for let's take the example of the verapamil. This will slow down the AV conduction. This will slow down the atrioventricular contraction, thus decreasing the heart rate, thus decreasing the contractility, blood pressure, and definitely the oxygen demand. This drug, this verapamil, as I have already discussed, this is non-dihydro. So it has more effect on your heart. So it has greater negative inotropic effect as compared to the dilatory effect. But when you compare the verapamil and amlodipine, then in that case, verapamil has greater negative inotropic effect as compared to that of the amlodipine. Verapamil. Verapamil is contraindicated in patients, as I have discussed that this is a drug that is slowing down your AV conduction. So this is contraindicated in patients with decrease or the depressed cardiac function or the AV conduction abnormalities. Now coming towards the delta-azam, this is a drug that will slow the AV conduction like that of the previous drug. It will decrease the firing rate of the SA node, that will decrease the pacemaker activity. This will also lead you towards the coronary artery vasodilation. So if I'm saying that this is causing the dilation in the coronary artery, so it means I'm trying to say this is the drug which you can use in the coronary artery spasm, in which the arteries are spasm or constricted. So if this is a dilator, it means this is the drug which you can use in the variant angina, which is also known as the vasospastic angina, Prinzmetal angina, or the rest angina. So students, this was all about the calcium channel blockers in angina.